So we have to embrace that weird uniqueness of our personalities and how we function and say, okay, this is a skill set that I have and I can help you. Let me tell you how I can help you.
Do you ever have so many questions and no one to ask, so they're just wasting away on Google searches you'll forget about in an hour or so?
We had that same problem, and that's why we created the RD2BE podcast, a resource for dietetic and nutrition students looking for answers that their peers don't have.
We are students Macy and Emily and registered dietitian Carl Barnes. We engage in conversations and learn from RDs.
Join us weekly as we gain insight into the unique journeys of registered dietitians all over the country.
Welcome to another week of the RD2BE podcast. I am your registered dietitian host, Carl Barnes. This is where we sit down with a new and exciting registered dietitian each week to profile their work experience, their career path, but more importantly, to really showcase the diversity of opportunities in the nutrition profession. As RD2BEs, no matter where you're at in your journey, it can be incredibly overwhelming and uncertain to know kind of what you want to do, and that is totally normal. Those that know what you want to do, you are probably the anomaly. But a lot of times we don't really get exposure to just how broad of a environment dietitians work in. So today we're sitting with a dietitian who works in school nutrition, which I'm super excited for. So we're here with Karen Olsen. I'll let you introduce yourself a little bit, and then Emily will take it away.
Sure. My name is Karen Olsen. I'm a dietitian working with Harford County Public Schools, which is in Maryland. Maryland has county-based school systems, so our school systems are fairly large versus a place like just up the road from us, Pennsylvania. They're township-based, so they're little smaller entities. So we have the advantage of having somewhat larger systems. I've been with school nutrition in various forms for 28 years. And before that, I worked with a woman who had a private practice, so I had a pretty broad scope of things to do. There are other dietitians who have different responsibilities than I do in school nutrition, but it's really cool because it's a pretty wide open field.
Great. Well, I'm looking forward to doing these questions with you. I'm Emily, your junior dietetic RD2BE at University of Maryland College Park. So going back to like your education and stuff, So how did you decide upon University of Delaware for both your undergraduate and your internship?
Well, I went to University of Delaware. I started out as a biology major, and I went in under their early admission honors program. So that's it sort of fell into place. I knew I liked the science of things, but after my freshman year, I realized after having been able to shadow a biologist, this is back in the day when internships where you could just go and like try out different people's jobs. It really wasn't a thing when I was at that age. And for some reason, my parents had the foresight to say, hey, you really need to kind of dip your toe in the water. Spent a day with this biologist, and his job was very interesting, but I realized it wasn't for me. And I knew I was going to, at that point, need an advanced degree, which I didn't think I could afford because we didn't have things like, remote learning, and you couldn't go to University of Colorado from Maryland to get a master's degree and those kind of things. So I wanted to combine my interest in cooking and food prep and food service and my interest in science, and talked to different people on the campus and came across this dietetics thing that I didn't even know existed. And I wanted hands-on experience. Drexel University is up the road from us. And that was at a time, one of those unique places. They had a 5-year program that included co-op work, and that appealed to me. So I knew once I switched majors that I liked the idea of I went through a CUP program, a coordinator undergraduate program in dietetics. So in the junior and senior year, you would go and actually work in different places through your internship, and it gave us 4 different quadrants. It was a generalist program, so we did food service prep, food service management, clinical, and community. And I like that because I had no idea what I wanted to do. And I like the idea that I could sort of look at different things. And I thought I might go more towards food service, but during my community rotation, I was like, I think I can do this. And that's where I was exposed to long-term care and that kind of thing. Long answer.
No, that's totally fine. It's better to have a lot more information that we can retain than not enough and we're just pulling for stuff.
Okay.
So I know you've worked in different fields, like you said, long-term care, community colleges, and as a food service specialist. So how do you think those jobs have prepared you for the past 28 years, like working in school nutrition?
My goal was always to expose myself to as many things as possible. So when I took my first job, that was with this consulting firm, and it was a small firm. It was my boss and me, and sometimes one other, either full-time or part-time person. So it was small, but each day of the week, I was in a different location depending on, our contracts. They were longer term contracts. So the majority were long-term care, but each one was unique. Some were very small mom and pop, like 60 patients, and then others were 150 some beds. And then another one was a life care community. So it had independent cottages all the way up to long-term care and skilled care unit. And then I did renal dialysis. And that was enough. I could do that a couple of times a month. And I was like, I don't know if I could do, renal full time. That's pretty intense. So just the ability to change and have to figure out, for me, how to work with so many different people and different management styles. That really prepared me for what I do now, because in a school, you go to an elementary school, this direction, that direction, and you have a principal who manages this way, and then you go that direction and you're talking about a different clientele, a different age kids, a different principal. So having to figure out how to work with all these different people who have completely different styles and maybe viewpoints, that really helps.
Do you work in one particular school or do you work for the county?
I work for the county.
Oh, okay.
So I'm in a central location. Yesterday I was on a phone call or on a meeting, Teams meeting with folks from middle school who have we have a student who has spastic quadriplegia from CP, cerebral palsy, and he had a choking episode. So we were meeting about that, but I also was on a phone call with somebody else because we're dealing with food allergies and how we're doing that. And then I moved over to another point where I'm reading all the waivers that just came out from USDA to try to figure out how we're going to implement meal feeding next year with that unique set of rules. So it's all over the place.
How many dietitians work within the county, or is it just you?
Me. Just me. We did have another dietitian at one time, but her role was more of a specialist role, and the specialists in our county function almost like regional managers. We have 3 of them, and we try to so everybody, each one of them has their own sort of forte. We have some that have more food prep experience, like we have one who's got a degree from Johnson & Wales. We have another one who has management experience with Marriott. We've had in the past some who are chefs, so it really depends on what we need at the time, kind of who fills those specialist roles.
So as a dietitian and I guess like an expert in the nutrition field, how is it communicating with those who don't have the knowledge when you're trying to implement, taking care of food allergies and being accommodating to what they need, like nutritionally, like for like lunches and stuff like that?
It's easier than you think, only because with schools, because it comes down from the USDA and the way the regs are set up, they've got to be able to be implemented by people who have no significant nutrition background. So it's kind of a plug and play. My role is, like most dietitians though, I think my expertise is that I know all of that, I understand all that science. And then my job as a dietitian is always to filter it down into something that is applicable right here and right now. I've been around long enough and have enough relationships with, the nursing staff, the school staff, the principals, and our staff, that if something wacky comes up, like with this child who had the incident, you know, somebody will come to the cafeteria and they'll say, wait a minute, I have to call Karen. And then they'll call me, and then we walk through the process of how to get all the medical gobbledygook, translate that into something that is, okay, this is what we're going to give this child today at lunch, and this is how we're going to keep this student safe, and this is how this process is going to work. So I have the unique place to try to translate the ideal into the what's this going to look like on the ground at 11:30 when you have 200 other kids coming in at the same time and you need to keep the kids safe.
Yeah, of course. How has nutrition in the school system changed over your 28 years of working in school nutrition?
A couple of things. Our guidelines are always set from the dietary guidelines. I mean, if you look at what they're set for, what they're designed for is for implementation of public policy. There used to be such a lag between the dietary guidelines being released and then our regulations. And so at one point we were supposed to be giving, we were supposed to be drinking skim milk, but the regs still said we had to give whole milk. So they've really been able to make that change much more seamlessly, much more quickly. So that's one thing. So what the public is hearing, over the loudspeaker when they go to the grocery store about the dietary guidelines and how we should eat is what we're doing in the schools. So that's been really cool. Our ability to be very transparent with the community has really helped. So like, people thought it was all this gobbledygook and, oh, well, they're, the whole thing about mystery meats and things like that, that whole joke about school lunch. Now I can say, well, go to our website, bring up the menu, hover over the menu item, and you can see a picture, the ingredient list, the nutrition profile. And people are much more accepting that, oh yeah, it really is real food. It's actually the same stuff I can buy in the grocery store in some cases. So that's been really kind of cool.
So for someone who's worked in both clinical and community environments, how would you compare and contrast those experiences that you've had?
It's for what I do, even though long-term care may be considered community, what you do there is very clinical. And what I like about long-term care was that I could actually see the impact that the clinical interventions had because you have these patients over a long period of time. So understanding clinical, what happens, and also understanding where physicians are coming from helps me when I get a diet order from a pediatrician that says this thing, and I'm like, okay, is that really what you mean? And then I'm much more comfortable saying, okay, we're going to talk with the nurse. The nurse is going to say, is this what you mean? This is what we can do. But a lot of what I do is a little bit of what I do is clinical. A lot of what I do is food systems and food management. And then another part of what I do is more teaching and nutrition education.
Sorry, I couldn't find my unmute button. Have you always wanted to work in a school system, or how did you get into that job role?
No, because frankly, when I was younger, kids scared me. it's a little intimidating until you get to a point where you're like, all right, this is not a big deal. I knew I needed to make a career shift at one point, because my one job, I was driving a lot, commuting a lot. And I was like, I think after almost 10 years of this, I'd like to be a little closer to home. I knew that family was important to me, so I wanted to be able to be accessible if I started a family and had kids. And I happened across this job opening, and it didn't really call for a dietitian, but I thought, this is, with my experiences, this is something I could do, because I was helping people get ready for, the county health department inspections with what I was doing. And so I had that skill set. And the first job that I had when I came to the school system really wasn't nutrition. It was more food management. But every time something that would come up that was nutrition related, they would say, oh, we're so glad we have an RD on staff. And there weren't a whole lot of RDs in school food service at that point. That's really changed. Dietitians working in school food service, if you look at, there's a practice group for school nutrition folks. The recent past president of both the academy and of the School Nutrition Association were both dietitians, which was really cool, because their tenures crossed over. So at one point we had school dietitians in the lead agencies, the lead organizations for us, which was cool. But it was more about the job and sort of what's the interest that I had at the time, and the idea of doing something different.
How are you able to obtain your school nutrition specialist credential?
Okay, that's a real critical thing, and I'm going to rah-rah for that. Not everybody, you don't need to be a dietitian to get your SNS, School Nutrition Specialist credential, and that is through the School Nutrition Association. What I tell people when they get that is that it immediately shows your level of professional commitment to your job, because there aren't a huge number. And it's one of those things, you can't just take the test and say, okay, well, I have this. You really need to understand how the program works. So you can be very smart and never have worked in food service, in school food service, and you're going to have a little bit of difficulty with that exam. So get a year under your belt in school nutrition, and then get the study guide, and the study guide will sort of walk you through the areas that you need to know, because you need to know public policy, you need to know nutrition, you need to know menu planning. I mean, it's a pretty broad scope. And then you can pass that. The School Nutrition Association website contains the SNS credentialing. There's also certification for people who are interested in not quite that level. So we have a lot of managers who are certified. There are a couple of different levels of that as well. But it's definitely a professional designation that shows your commitment to the profession.
Why do you think not many people obtain that credential?
It's up and coming. It's just people have to decide, and recognize it. So I think it's more promoting the benefit of having it. Every year we have more and more folks who take the test, and we're trying to make it more and more accessible. Right now it's kind of like the RD exam was back in my day, where you had to actually go physically to a site and physically take it. Whereas now, and then you had to wait for the results. I mean, I couldn't take my test. I graduated in June. I couldn't take my test till October. And then I don't think I got my results for another month or a month and a half. So yeah, talk about nail biting. So now you have to actually physically go to a place. Eventually we're looking at having that accessible, so you can do like the remote precepting and things like that. So that'll help. But it's also, folks need to encourage others to get it.
Are there continuing like education credits you could do for that? Do you have to keep up like
Mhm,
certain hours throughout the year? What does that look
mhm.
like?
Yeah, it pretty much parallels what you would do for your RD. So if you're doing CEUs for your RD, you're covered. Between my license for the state of Maryland, my RD, and my SNS, I pretty much I look for continuing education that's going to help me in my job, and then go from there. And especially if you go to like School Nutrition Association convention, if I go to that, I mean, that covers you for that year. So it's not a challenge to try to meet it. Doesn't add to the burden.
That's good to hear as like people are going up, and I know a few classmates of mine are like, we're going to get this credential, but then we have to do more education. Like how much is that going to factor into like work and stuff like that? So I thought,
There's so many, there are easy ways to get those CEUs. I mean, even just reading the journal article and then taking the test, if you do that once a month, that pretty much, takes a huge hunk. If you take, you'll find things that you're like, oh, well, this is a really interesting webinar. I want to know a little more about this. Gut microbiota right now is I want to hear another one of those. So you listen to a couple of those, and it's not hard to take it off. For us, when we have our state meeting with the Maryland State Department of Education, all of the education authorities get together, the counties get together, and they have these meetings, a couple times a year. And, 2 of those meetings, it'll tick off 4 to 6 CEUs just attending the meeting. So part of your everyday, work a day. It just is, you integrate because you want to learn more. You'll see things that catch your eye. One of the things I wrote down was understanding that change is hard all the time. As new dietitians, a lot of times you're like, okay, well, this is how this works. You have to remember that us old folks who've been around for a while, we learned under sometimes slightly different paradigm. So I happened across an article that was talking about how albumin's not a good marker for nutrition status. I'm like, wait a minute, what? That's new, because for us it was the gold standard. So I'm like, okay, I got to pick up that article. I'm going to read that one, and understand and try to figure out, and as I'm reading it, I'm going, okay, well, yeah, I knew that. So of course it's the change isn't always as drastic as we think, but keeping up is absolutely important.
those headliners really throw you for a loop.
Yeah.
That's how they get you. So when I was like doing some research on you and stuff like that, I noticed that you host interns. So what does that look like?
It depends. We've hosted high school students who are interested in nutrition. In our county, we have a technical high school, and we have a sports medicine program, sports technician program, and a health occupations program. So sometimes we'll have folks there who aren't necessarily interested in going directly into sports medicine or right into nursing or staying in nursing, and they're interested in nutrition. So they'll come and they'll spend a couple of hours like every other day when they get to their senior year to kind of see what I do, and we talk about different career paths. I host dietetic interns who are in like an Aramark program. I've done Aramark before. Distance programs, the WIC program, and what they do depends on what part of the rotation they're trying to fulfill. So if they're doing their community rotation, they only be with me for like 2 weeks, and I try to schedule it at a time when maybe we have a lot of health fairs in the evening that we're going out, we're doing actually like out there education type stuff. Or like February for us typically is the kindergarten nutrition healthy me unit. So I'll go out and I'll talk to some kindergarten classes. WIC, usually it'll be like food management. So they'll come with me and then I'll send them out with our area specialists a lot of times. And so they'll like learn how to do a specialist report and an audit and what that kind of, and we meet those CDR competencies. So we try to align it, you know, based on what they need. I've had over 50 folks who've come through our department, and my goal has always been to introduce people to school nutrition because it's really fun. There's so many different things you can do with it, and it's a really great group of people to work with. I think this year has showcased what school nutrition professionals are about, because when the schools closed down and the kids didn't have access to food, in a matter of 3 days, 4 days, we had to create a new delivery system. And our folks were out on the front lines and they were smiling and they were so excited to be there. And on days like this, when it snows, on days when there's pouring rain, I've been with a group of folks over this last year that as we're delivering the meal kits or having them out, they're wearing dinosaur blow up costumes. So it's a great, fun group of people to be with most of the time. I mean, we get cranky, but it's just it's a really neat group of people.
So since like school nutrition is a very like specialized niche area, what is one thing you really want your high school students or your dietetic interns to take away by the time they leave?
Really, the systems, the knowledge goes across multiple platforms. So if you get any kind of food management background, you know, you can adapt it to this. We've had folks who've come into working in school nutrition, who've come from restaurants, who've come from college food service. So you can, there's a basic core knowledge that you need, which is what you learn in school, what you learn in your internship. You practice that. And then it's just the idea that you have to be adaptable. And you have to learn to be proud of what you do and figure out how to honk your horn, to explain what you're doing to other people and give them a different perspective. Again, you know, like people pick on hospital food or they pick on school food, and you know, oh yeah, it's just, you know, throwing the hash out. And then when I go to talk to sometimes I'll talk to high school students doing, you know, a My Plate presentation, but I also take a few minutes to say, okay, if you're interested in nutrition and food, this is an option. And let me tell you about school food service. Think of it today, now during non-COVID times. In our school system, by the time 9 o'clock rolls around, we've served 10,000 breakfasts in 58 locations. And by the time 1 o'clock rolls around, we will have served 20,000 lunches in 58 locations with over 400 employees. So giving them that sense of the volume, the scope, the number of people that it takes, I see the kids sort of sit back and go, this is a little bit more than I expected. It's not just, you know, the few cafeteria folks that I see, you know, when I can get my lunch line. There's, you know, in my high school, there might actually be 14 folks in the back. So it just sort of letting people know what we do and why we do it, and highlighting that, you know, they're not just hash slingers, they're professionals and they're amazing.
Great. Well, that's awesome advice. So speaking of advice, I guess I can wrap up with this. What advice would you have for students that are contemplating going into this school nutrition route?
I would say make sure you get some clinical experience of some sort, because that, as the RD, you're going to be looked at as a nutrition resource. So you need to be able to actually understand sort of those systems. You know, the fact that I can very confidently say, okay, you can't send me the skin prick test results. That does nothing for me. Although I can interpret them, I need the medical doctor to tell me what he thinks this means for this patient. I need to know what, spastic quadriplegia is and how that impacts swallowing and what a modified barium swallow is. So I can be that explainer. And then I need to be able to take all of the science and filter it down so that it's simple for people to understand without talking down to them, without it being intimidating, saying, okay, you've heard about all this. Okay, let me tell you what this really means when you're walking through the grocery store. So definitely some life experience, some clinical knowledge helps.
Great. Well, thank you so much. I appreciate you taking time
welcome.
out on this snowy April 22nd.
I know, crazy.
I really appreciate you sitting down with us, and I like how you kind of highlighted, and it speaks volumes to initiative, I think, in recognizing areas that you have an interest in, but traditionally dietitians don't work in. And I think
Right.
so much of the innovation in our profession happens that way, and it takes
Yes.
leaders to step into that and make the setting, not waiting for the
Right.
general consensus. So that's fantastic.
Yeah, be confident in some of the skills you have, because we have our uniqueness. I mean, if I show you, if I show normal people this, they don't get it. But if I show dietitians this,
I have one from every DPG at Fancy.
yes, I mean, there's just something unique about us, and I can tell a potential dietitian is going to do well when he or she gets excited about, seeing all the different tabs and colors, or if I have different color pens and they get very excited. So we have to embrace that weird uniqueness of our personalities and how we function, and say, okay, this is a skill set that I have and I can help you. Let me tell you how I can help you. Because people don't understand what they don't know about. So, be okay with saying, hey, look, I think I can do this for you. And I think, you'll appreciate this.
And lastly, I also have to commend you and all the school nutrition professionals, both dietitians and just food service workers of the like. This last year, you guys have really shown your true colors and stepped truly to the front lines and done some incredible work.
Absolutely. And I'm so proud to be part of the community of school nutrition professionals. They just warm my heart every day. Make me crazy some days, but they warm my heart every day.
Well, thank you, and thank everyone for listening along, and stay tuned for another interview next week.
All righty.